Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Bruises. Introduction. A bruise happens when small blood vessels under the skin get injured and leak blood. Bruises can happen anytime you injure your body or even after surgery. There are different types of bruises. Most bruises are not serious and will go away over a period of a few weeks to a few months. However, sometimes bruises can be signs of a more serious problem. This program will help you understand bruises. It discusses the symptoms, causes, and types of bruises. It also covers how to treat bruises and when to seek medical advice. Bruises. There are different types of bruises. You can get skin, muscle, and bone bruises. Bone bruises are the most serious. Some bruises also have special names depending on where they form. For example, a bruise on the head is sometimes called a goose egg. A bruise that forms just under the eye is called a black eye or shiner. Bruises may develop after injuries that do not cause the skin to break open. Even though the skin is unbroken, the tissue and blood vessels under the skin become damaged. Small blood vessels under the skin may leak blood when they become damaged. These small blood vessels are called capillaries. The blood leaked by the capillaries gets trapped under the skin and a bruise forms. Some but not all bruises cause skin discoloration. As the trapped blood is reabsorbed by the body, the bruise may change colors. The marks caused by bruises fade over time. Symptoms. Bruises are often painful and swollen. Most but not all bruises leave a mark on the skin. They may start off as a reddish color as the blood pools under the skin. Within a few hours to 1 or 2 days, the bruise may turn bluish-purple or even black. This is because the hemoglobin in the blood changes. After 5 to 10 days or longer, the bruise may become less blue and purple as it fades. The bruise may become more of a greenish-yellow color. After 10 to 14 days or longer, the bruise may turn yellowish-brown or a light brown color. Eventually, the discoloration caused by a bruise will fade away. Most bruises last about 2 weeks. However, some bruises can last months. It just depends on how long it takes the body to break down and reabsorb the blood under the skin.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. A bruise forms when a part of the body is injured. For example, a bruise can appear after a person falls down the stairs or off a bike. A bruise can also form when a part of the body is crushed or struck, such as when a person stubs their toe or is accidentally hit by a baseball. Bruises may also form after certain types of surgery. Often small bruises are considered normal. Talk to your healthcare provider for more information about bruising after surgery. It is also common for some athletes or people who exercise often to get bruises. Demanding exercises may cause small tears in blood vessels under the skin. As people get older, blood vessels and skin become more fragile. This is why elderly people bruise more easily than younger people. Certain diseases or medications can also cause a person to bruise. For example, people who take blood-thinning medications are more likely to bruise than people who are not taking these medications. Treatment for bruises. Most bruises do not require medical treatment and will fade over time. However, there are some home treatments that will help reduce bruising. Icing the injured area is the best way to reduce bruising. Icing works best when done right after the area is injured. Apply the ice or cold pack to the injured area several times a day in the first day or two after the injury. Elevating the injured area above the heart can also reduce bruising. This slows the blood flow to the injured area and keeps blood from leaking out of the injured capillaries. Acetaminophen can be taken to reduce pain. Ibuprofen can be taken to reduce pain and swelling. It is also important to rest the injured area to help it heal. The pooled blood that makes a bruise may also fade faster if the injured part of the body is less active. When to seek medical advice. Sometimes a person does not remember how they injured themselves or why they may have gotten a bruise. Many bruises go away on their own. However, some bruises may be a sign of a more serious problem. Sometimes bruises with constant pain or a headache can be a sign of a serious illness. See your healthcare provider if you have these symptoms. Other times, bruises can be a sign of a blood clotting problem or blood-related disease. See your healthcare provider if you bruise easily, develop bruises without injuries, experience abnormal bleeding, have abnormally large or painful bruises. Contact your healthcare provider if you have a bruise that does not seem to be going away. Most bruises fade after 2 weeks, but some may take longer. If a bruise forms on your head or around the eye, you should seek medical advice. Sometimes these bruises may be the result of a serious head injury. Prevention. Preventing bruises can be hard. However, there are a few simple steps you can take to prevent bruises by preventing injuries and accidents. Keep your home free from clutter. Make sure cords are not in walking areas, and remove rugs if they are a tripping hazard. Be sure your floors are dry before walking on them. It only takes a small amount of water to make a floor slippery. While participating in sports or riding a bike, wear protective gear. This can help protect your body from damage. Use a flashlight if you need to go to the bathroom at night. You can also plug in night lights to light your path. If you're on blood thinning medications, make regular appointments with your healthcare provider. These appointments are needed to check your blood and adjust your medication if needed.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A bruise happens when small blood vessels under the skin get injured and leak blood. It happens when an injury crushes small blood vessels but does not break the skin. Those vessels break open and leak blood under the skin. It can take months for a bruise to fade, but most last about 2 weeks. They often start off a reddish color and then turn bluish purple and greenish yellow before returning to normal. Sometimes bruises can be signs of a more serious problem. Check with your healthcare provider if you are concerned about a bruise or if the bruise does not fade. Most bruises are not serious and do not require medical treatment. To reduce bruising and help a bruise heal, you can ice and rest the injured area. Elevate the injured area above the heart. Take medications to reduce pain and swelling.
Thank you for using Explain.